No. Mm. Hello, I'm Dr. Trivedi, a doctor working here today. May I confirm your name and age, please?
Hi, doctor. My name is Annie Hathaway, and I am 78 years.
Okay, how may I address you?
Doctor, please call me Annie.
Okay, Mrs. Annie, today we are going to discuss about your health issues. Is that all right?
Okay, doctor.
Okay, and during our discussion, I might take down some notes, which will be strictly confidential. Is it okay?
Okay, doctor.
Okay, now, Mrs. Annie, can you please tell me in your own words what have brought you here today?
Doctor, for the last couple of months, I felt unusually weak, but I am living alone, so it wasn't possible for me to visit a GP regularly for that. And I
Okay.
am a patient of rheumatoid arthritis. For that, I need to take medication, and already I need to visit the doctors 6 monthly. So I didn't visit any GP after feeling the tiredness. I thought that it was due to my age, but for the last 7 days, I felt that I am severely weak. Even I cannot do my household works. That was a very worrying thing for me. And after that, I was unable to do my job. So I visited my GP and I told him that I am suffering from this type of excessive weakness. And after that, he examined me and he ran some blood test and he found out that I have a severely low blood count. And he immediately told me that I need to transfuse blood. And over the 3 consecutive days, he transfused 3 units of blood. After that, I am feeling good, and he suspect that I might have some problem due to this rheumatoid arthritis drug, that is methotrexate. So he sent me here and for further evaluation if I need to take this medication or if I need any other thing.
Okay, I will try my level best to find out what's actually has caused your trouble. May you please tell me more in detail what do you actually mean by weakness? What actually happened to you? That just
Doctor,
you felt tired or anything else?
yes, doctor, I felt tired than usual. That was something unusual for me. Initially, I thought that it was due to my age, but that wasn't improving. Even after taking rest, that wasn't improving. And
Okay.
ultimately, I was incapacitated to do my own jobs. I live alone, and I had to cook for myself. I had to wash my clothes. I couldn't do that also.
Yes, I can get it. And can you please tell me that did it come along gradually or quickly, suddenly?
Quite gradually,
This problem?
quite gradually.
Gradually. Okay. And is this present all the time? Recently, you told that for the last 1 week, is it very severe? It is. So is it
Yes,
present
doctor,
all?
it is present for the last about 5 or 6 months, but for last week, I was totally incapacitated.
Okay. Okay. And may I know that do you have to use extra pillows at night to be more comfortable during sleep?
No.
Okay. And do you have any swelling in your legs?
No.
Okay. And do you feel that there is anything that makes you feel better of your shortness of breath?
Not
Or
shortness
this
of breath, doctor. I
sorry,
was
this
feeling
weakness?
tired.
Yes, this tiredness.
No.
Sorry. Okay. And anything that makes it worse apart from trying to do some work?
No.
Okay. May I ask you that do you have any chest pain?
No.
Any racing and pacing of your heart?
No.
Okay. Any shortness of breath?
A little bit when I work, then I feel somewhat shortness of breath. Whether it is somewhat I would call it weakness, not shortness of breath.
Okay, that's all right. And may I ask you that do you have any chest tightness?
No.
Any noisy chest?
No.
Okay. Now let me ask you that some other questions. That do you have any headache?
No.
Okay. Any difficulties in your visions or any changes in your vision?
No.
Any soreness in your mouth or any other part?
So doctor, I had some soreness in my mouth and mainly over the tongue, and that went away. That was last episode was about 1 week. Oh, sorry, 1 month back.
Okay, okay. Well, may I know that was that so painful or painless
Yes,
or
doctor.
something like?
It was painful, and I was taking some vitamin tablets for that, and that helped me.
Okay, and that helped.
Yes, doctor.
Okay, and now you are completely okay with that.
Yes, doctor.
Well, I'm actually okay. May I ask you that do you have any soreness in any other parts of your body?
No,
Okay, any joint pain,
no,
any rashes?
no,
Okay. May I know that do you have any raised temperature?
no, doctor.
Okay. Any loss of weight?
Yes, doctor. That is another issue that I think for last 5 or 6 months I have lost around 7 kg. Usually I visit my doctor, that is joint doctor, every 6 months, and
Okay.
in the last visit I was 79 kg, but uh, 3 days back it was 72.
3 days back it was 72. Okay. And may I know was it intentional or unintentional?
No, doctor, I haven't had any intention to lose weight.
Okay. And do you have any weather preferences?
No,
Okay. And do you have any weakness in any parts of your body?
no,
Any neck pain?
no,
Any difficulties in your swallowing?
no,
Any difficulties in speech anytime?
no.
Okay. Do you think that there is any change of your skin color, like you're getting pale or something like that?
I think I had become somewhat failure.
Okay. For how long do you think so? Or when did you notice it?
Maybe for last 2 months.
Just 2 months. Okay. And do you notice it yourself or do anyone other else notice it?
No, I think I noticed that I changed tone is somewhat changed.
Yeah, yeah. Okay. And do you think that there was any, was it all the same during the 2 months or did it gradually increase this paling, pallor of your skin?
It was increasing.
It was increasing. Okay. And may I ask you some other questions that how about your water works?
I think it is fine.
Have you ever noticed any blood in your water works?
No,
Okay. And any poor screaming or dribbling while doing your water works?
no.
Okay. And how about your bowel movements?
For doctor, that is also another issue that for last 5 or 6 months, I noticed that I am less frequently passing my bowel. This wasn't usual for me. And even I think every 3 or 4 days, I had to pass my bowel. And previously, I usually pass my bowel every day. And also, I think I have become a little bit constipated, and I am passing sometimes hard stool.
Okay. And have you been on any medication for this?
No,
Okay. And have you ever noticed any blood in while doing your bowel movement?
I noticed about 3 or 4 times that I had some blood, but I thought that it was due to constipation. I had to put severely strain for that.
Yeah, yeah. Do you have any tummy pain?
No,
Okay. Well, you told that you had noticed some blood, and well, did you seek any medical attention for this
no,
problem?
doctor, no,
Okay. Have you noticed that is there any relation with any kind of food or anything else that makes it better or worse? This
no.
constipation? Okay. And okay. And uh, okay. And may I ask you now some other questions that have you been on? Have you been suffering from any known disease, any long-term disease or chronic disease?
Yes, doctor, I have rheumatoid arthritis.
Yes, yes, you told me about it. And on you are on which medication? May you know? May I know?
Methotrexate, doctor. Methotrexate, and sometimes when it became worse, I had to take some steroid tablet.
Yeah, yeah. For how long have you been taking this methotrexate?
15 years.
Has there been any recent change in your dose of methotrexate?
No,
Okay. And Okay, and do you suffer from any other diseases?
No,
Okay, any problems with your high blood pressure or
no, no,
diabetes? Okay, and may I ask you that do you ever had any heart attack or stroke?
no.
Okay, that's all right. And may I ask you that do you have any other significant family history of diseases?
My mother had a stroke at his age of
At which age?
at her age of 70.
7. Okay, any other diseases?
No,
Any known heart diseases or any history of sudden death?
no.
Okay, and okay, and well, may I ask you some personal questions that are you apart from this medication you told you haven't been to any other medication? You claim
I,
that
I, I I take some vitamin tablets, doctor, because I told
yeah,
you that I felt weak,
yeah,
tiredness, so
okay,
that I thought that this was might be due to vitamin deficiency. So I took that from the pharmacy and I was taking those.
yeah, that's all right. May I know that may I know about your dietary habit? What do you usually have for your diet?
Regular diet what the British people take.
Okay, that's all right. And may I know that I'm sorry to ask again about your family. Do you have any member in your family with any bowel cancer?
No,
Okay, that's all right. And may I ask you some personal questions now? I'm sorry to ask, but do you smoke?
I stopped smoking for about 5 years.
Okay, okay, that's good. And may I know that do you drink alcohol?
No,
That's very appreciable. And I'm very sorry to ask actually, but I have to that whether you take any kinds of recreational medication, although it's highly unlikely, and I'm very sorry, but may I know?
no, never, doctor.
Yeah, that's all right. And
You
may I
mention
know
any?
that? Yeah. May I know that have you been to travel to any country recently?
No,
Okay. And may I know that whom do you live with?
I am living alone, doctor.
Living alone. And okay. And may I know that where do you live? In an apartment or old house or anything? Can you please
Apartment.
spell? Okay. And is it a new one or old one?
New.
Okay. Okay, that's all right. And are you well supported economically and socially? Do you think?
I was office clerk and I had a little bit uh, for my maintenance. I think I don't need special support for that.
Okay, that's all right. And okay, and may I know that what your concerns are?
Doctor, my GP said that this might be due to the methotrexate I take. So, do I need to take sense this medication because before taking the methotrexate, I had a severe problem with my rheumatoid arthritis disease. And after taking this methotrexate, I am feeling good and I am maintaining a good quality of life.
Yeah. Yeah. Okay. Well, actually, at this moment, it's quite difficult to be totally sure about what's causing your problems. For this reason, I will have to at first examine you properly and also assess you by some blood tests and other tests. And but as long as I have taken your history, I think that there might be some
I'm
causes.
up,
Okay.
but you can continue.
Hello.
Yes, you can continue.
Okay. I think it's at the moment I will have to do at first some blood tests and some other scanning, some blood test at first to find out whether what's the actual cause, and after that I think I can be more sure about it. Okay, are you getting me?
Yes, doctor.
Yes, and okay, and do you have any more concerns?
Doctor, I needed already 3 units of blood, and
Yeah.
do I need to take this blood regularly?
Okay. Well, actually, at this moment, we will have to we'll have to do some other test actually, because there might be some causes of your requirement of blood. Okay, I'm sorry to say, but we have to do some scanning tests of your tummy as well, and we will have to find out that whether there is some other causes. And after finding out the cause, we can get to you that whether you need uh, more blood or not regularly. Will it be okay?
Okay, doctor.
Okay. Any more concerns?
Oh, doctor, can you give me some medication for my bowel problem?
Yes. Actually, at the moment, it's more important to find out what's actually going on with your bowel. Okay. So I think uh, apart from giving you some medication, we will also involve the bowel doctor and other specialists to find out the cause by doing some scanning tests and other tests, and that will be much more beneficial to you. Okay, rather than just giving you some temporary treatment, I think. Is that all right?
Okay, doctor.
Okay. Any more questions or query?
No, thank you.
Okay.
So you have 1 minute to gather your thinking. You ready to continue?
Okay.
Okay, so what do you think the cause of anemia in this lady?
I think there might be some differentials in this patient, but I think the main differential, I think I would go for any colonic involvement, like I think any colon cancer, or I think some, although it's unlikely, that any ulcerative colitis, and I think some vasculitis can also be brought in the P here. Rheumatoid arthritis related vasculitis, and rarely lymphoma or tuberculosis, I think, and maybe angiodysplasia as well.
Okay, why not methotrexate induced anemia?
Well, actually, it can be, but it's actually a long time since she has been taking methotrexate, around 15 years. So I'm not sure whether this should be brought under DD. I'm not sure about it.
Yes, this can cause even after a long time.
Okay, I didn't know about it.
Okay, for colonic involvement, I think you should have asked more about that. Okay, how will you investigate her?
Okay. First of all, I think I would go for some routine blood test, like CBC with ESR. In the CBC, I might go have to look for pancytopenia or present or not, anemia, leukocytopenia, or and thrombocytopenia, and ESR may be raised or not. And then CRP, and then also go for rheumatoid factor assay and anti-CCP antibody testing, and then go for a liver function test and renal function test. And I might also go for do some Coombs test to find out whether there is any autoimmune association present or not. And and then I might involve the gastroenterologist to do some scanning tests, like a plain X-ray of abdomen, EpiView, CT scan of abdomen, and whether any sigmoidoscopy or colonoscopy is needed or not. Hello.
Okay.
Yeah.
Do you think peripheral blood pain?
Yeah. Peripheral blood film must be done.
Okay, can be done after taking getting 3 units of transfusion?
I'm not sure about it. I'm sorry.
Any ultrasonogram of abdomen, do you think?
Yeah. Plain X-ray of abdomen, ultrasound of abdomen, CT scan. I think CT scan is superior, but ultrasound of abdomen can also be done.
Okay, fine. What could be the risk factor for our colonic cancer? for this lady?
I think the risk factor, I think there has been weight loss, significant weight loss in the last 5 months, I think.
I
That-
think I have asked you the risk factors.
Okay, risk factors. Risk factors. In this patient, I cannot elicit at this moment.
Okay, about her heavy dietary habit, high
Yeah, I didn't ask about it. Just
high consumption of meat, and after that, smoking. She was a smoker, and also
yeah.
if you have asked about alcohol in more details, then she would also tell you that she was a heavy drinker in the past.
Okay. Mhm.
Okay, after that, I am coming to the history taking. Your history taking was fine, and I think you should have asked more about gastrointestinal symptoms, some red flags,
Mhm.
like any lumps or bumps.
Yeah, I just missed it.
Yeah, and any nighttime passes of bowel.
Yeah. I should have asked tummy pain, any nausea, any vomiting, bloody vomiting, any
Yeah.
jealous discoloration.
And
Then I think,
the more about the blood in stool.
yeah, how was it frank or not, or was it mixed, and was there any pain while bowel motion, and any nighttime problems, any nighttime problems, and in relation with food and any specific type of food. Is the stool mixed with the mucus, I think, and anything making it better or worse? I think all this should have been asked. I didn't ask it.
Yeah.
Any of
Otherwise, this was fine.
Okay, so what was the case actually?
The case was colonic carcinoma.
Colonic carcinoma.
Present, yes. And for methotrexate also, methotrexate can cause anemia, that is Pelty syndrome. And
Sorry, what syndrome?
that is rheumatoid arthritis itself can cause anemia, like as a part of chronic disease.
Yeah.
And methotrexate induced folate deficiency.
Yeah.
And that is called, and she was taking some steroid, and she could have also taken some NSAIDs. So NSAIDs induced bleeding that could also cause. And also as part of Pelty syndrome.
Yeah, as part of Pelty syndrome. Yes, I told about vasculitis. I'm not sure. I think I was wrong. But vasculitis can vasculitis cause this type of anemia?
Vasculitis can cause, but she has no rash, no other symptoms. No.
Yeah, but she had one history of soreness. That's why I told about this vasculitis.
Okay, maybe due to vitamin deficiency.
Yeah. Okay, that's all right.
Okay, fine.
Okay, and any more details? And actually, 2 more people are here, I think. They can contribute to a discussion. Tony Apu or Sharmin Apu.